be aware we have a council meeting at 2:30. So without cover over and not dealing with the papers properly, I think I would emphasise that maybe it's important to keep our questions and answers brief and to the point so we get through this in time to have a little thought before 2:30 when the meeting starts. No, I'm suggesting that we shouldn't audit or scrutinise, but let's be concise where that helps. All right, our next paper is number 7. This is the Council Financial Performance for 25-26. This will be getting to us by our Chief Financial Officer. It's Lindsay Grattan.
Thank you. Good afternoon. This report provides an update on the financial performance of the Council for the year ended 31st March, based on actual spend to December. General Fund revenue is forecasting an underspend of 5.2 million for the year, which is a favourable movement of 2.6 million since last reported as of September, mainly as a result of additional funding which will be carried forward to 26-27. A summary of the position across directorates is provided in Appendix 1, with full detail of spend by service area and forecast movements provided in Appendices 3 to 6. A summary of earmarked reserves is provided in Table 4.6 of the report, which shows the opening committed reserves at the 1st of April is 16.2 million. Earmarked reserves include funding and income with specific terms and conditions, funding that has been committed for specific council priorities, and funding to cover projects not completed the previous year. Spend may be committed against the projects, however, budget is only drawn down when the actual spend is incurred. And as at December, 3.4 million has been drawn down, leaving a balance of 12.8 million. The client manager element of the Health and Social Care Partnership is forecasting an overspend for the year of 6.4 million as at the end of December, with an overall overspend for the partnership of around 15 million before any release of earmarked reserves and contributions from partners. Detailed spend against budget is shown in Appendix 7, and there's also another report on the agenda. In relation to savings, the Council is forecast to deliver 3.3 million of the approved 3.8 million, which equates to 86%. The remaining 544,000 has been identified as not achievable this financial year and will be carried forward. Details of individual savings are included in Appendix 2. The General Fund Capital Programme is forecasting an underspend of 7.3 million across various projects, which is an increase of 1.5 million on their Q2 outturn. Again, a summary of the forecast per asset plan is provided at section 6.3 of the report, and detail by project is provided in Appendix 8. So I'm happy to work with my colleagues to take any questions on the paper. Thank you.
Councillor Force.
Yeah, I've got a couple of questions. It's quite difficult sometimes because we know that there's a lot of time lag and we've actually kind of passed this point in time and things have moved on. But I want to ask some questions around the capital programme underspend. I'm just wondering what the primary causes of the underspend are and how much is this due to internal issues such as capacity, etc., versus external issues like contractors or other factors that come up.
Thank you. So it's quite difficult because we have quite a large capital programme with difficult projects. One of the large areas of overspend is the Wellbeing Hub. As you know, it's a multi-year project and it's not uncommon for projects like that to slip in terms of phasing. So we do an estimate of the phasing of when the cost would be incurred. But that doesn't mean to say the project is slipping. It's just the timing of when the payments are actually made for the work that's getting done. So part of the underspend is related to that. There are some projects where we've been unable to deliver because of capacity. So we've had to prioritise other pieces of work that have come in the year that is maybe reactive to weather conditions that have caused something. So we've had to delay because of that. There are other projects where contractors are unable to deliver. We don't have the internal capacity to deliver. So it's a mix of things throughout each of the projects, and hopefully the explanations against the projects would explain why it's done for each specific one.
And I suppose, given that there is a time lag between the reports, this is the quarter that ended in December and things move on, I'm just wondering what governance or performance monitors are in place to prevent repeated slippages and major capital projects, so that when we're seeing slippages happen, action is taken, and are they there to address it?
Thank you. So we've had the capital operations group that has operated over the last few years. So they meet every couple of months and they monitor the spend against the capital programme. And we discuss in that group where there are slippages and what the reasons for those slippages are, and if there's any need for any recovery action. So potentially if there's an overspend on a project, what action is needed, what governance do we need to take? And that's documented through the capital operations group. That's really the crux of that governance, as well as along with the other aspects of monitoring. We have the budget holder meetings each quarter, so the budget holders meet with the finance department and they discuss that, and then that's fed up to the management teams for each service area. So there's double scrutiny there before it comes through to the committees as well.
And Lindsay, a big one on page 132, the very last item was the 198,000, 99,000, not achievable operational revenue savings, sale of properties. That seemed a kind of odd on that. Do we think that would be something that was more a function of external problems rather than internal? What would make it difficult to achieve something like that?
Thank you. So from understanding questions, so we had a saving in for reduction in costs through sale of properties. So there is a time to get the properties ready for sale and to get them marketed and the different type of marketing that we could do for each property. So in this case, there's quite a few properties within that grouping there, and the police services have been taking action to market those. But from my understanding, we have to go through a lot of procedures and make sure that the legal documents are in place as well before we can actively sell them. So these things can take time to do along with the other day-to-day tasks that we've got. So slippage in that delay to put them on the market, and then it depends if there is a market for them. So if somebody comes forward to buy them, if it's been on the market for a while, but there's no guarantee that somebody will want them just because we're due to sell them. So it's a mixture of things like that.
Okay, thanks. Councillor Rennie.
Thank you, Chair. Just a couple of points on the table of earmarked reserves. So first of all, in terms of obviously the transformation fund still sitting at a high level, as is the general service pressure. Will they be spent out by the end of the financial year, or will they continue on? And my follow-up question is on other miscellaneous commitments. Would it be possible to have a breakdown of those for committee, just for us to have more of a picture of them?
Thank you. Yes. So as I said in the introduction, the earmarked reserves are only drawn down when the actual spend is incurred. So for the transformation fund, it is quite a substantial fund, but there are commitments against that. So we regularly report to the Be the Future Board with the individual projects that make up that transformation fund and the spend on those. And sometimes the spend doesn't come through till the end of the year, and that's where you would expect to see some shift. However, again, the transformation fund projects are generally multi-year projects and not just 1 year. So we would expect to see that drip fed over a number of years rather than all just consumed within the one financial year. But the general services pressure, that was in partly the additional cost of the increase in the NI. There was also some money set aside for the health and social care partnership pressure for 24-25. So when we come to the end of the year, again, that will be mostly reduced down to nil for that pressure. That has been fully committed and will be spent by the end of the year. In terms of miscellaneous, yep, I've provided the committee a list of those in the past as an ad hoc, but I'm happy to include that as an appendix going forward for future reports, so there's more visibility and transparency over that.
Any other questions? No. I took well forward. What's the paper? Seconder? Can I go to second the paper? Councillor Keogh, thank you very much. Does anyone wish to debate the paper? No, going to be a quick show of hands to approve. Fine, unanimous. Thank you very much, Lindsay. Moving on to the next item, which is item 8, HRA Financial Performance 25-26, report by Chief Financial Officer once again.
Thank you. So this paper provides an update on the financial performance for the Housing Revenue Account for the year ending 31st of March, based on actual spend for December. Revenue is forecasting a surplus of 6.3 million, which is 1.7 million greater than budgeted, and an increase of 505,000 from Q2. The main driver of this underspend and movement continues to be within staffing costs due to vacancies and related underspends within supplies and services, as projects are not able to be progressed due to capacity issues. This is partly offset by overspends within third-party payments, as contractors are being used to support the service delivery to compensate the absences. Detail of the over and underspends by subjective area are provided in Appendix 1 to the report. Capital programme is forecasting an underspend of 6.8 million across various projects, of which 5.4 million is proposed to be carried forward. Majority of the underspend is attributable to the project at Lockheed Road, off-the-shelf purchases and roof and render upgrades. And again, the report provides a summary of the main projects contributing to the underspend, and detail by project is provided in Appendix 2. Again, happy to answer any questions along with colleagues on the report.
Councillor Forson.
Yeah, and try to figure out how to articulate this question. When councillors are given all the information about the HRA budget and the budget setting process, we're given a figure that we're told is needed to increase rents by to ensure that we meet the revenue costs and that we meet the capital costs. Now, when we're forecasting such a big kind of underspend in the revenue and quite a big underspend in the capital, how can we be assured that the figures that we're being given in relation to increasing rents is actually accurate? And we're carrying, this forward. So would that impact in future years that rents could be increased by not as great an amount, or does that not factor into the calculations at all?
Thank you. So when we set the approved budget, it's based on the work that we anticipate to do during the year, and that's a planned programme of work. Again, things come up through the year that sometimes delay some of that work, and we always look to the next year to reprofile that to still carry out the same amount of work. So in certain areas, we do more work the next year and we carry it forward. But any underspend in the HRA is ring-fenced to the underspend and goes into reserves to support future capital spend. So although the rents are rising in 1 year and additional income is coming in, that is banked, as it were, from that work. So we would look at the profile and look at our reserves balance first before we then look at what rent increase. So potentially, if we have an underspend in the previous year, that would increase our reserves, allow us to put more into our capital for next year, which potentially could reduce the increase in the rent for the future year. But it depends on that capital, because we would always try and catch up on that work. So it doesn't necessarily correlate. We take all these things into consideration when we're looking to prepare and set the budget.
So if I understand that basically a surplus in the rental side of the operation can eventually end up being capital expenditure. It can do. Okay.
Yes. So the surplus that is generated on the Housing Revenue Account, we call it CFCR. So that is the revenue contribution to pay for capital, because Housing Revenue Account doesn't get any capital funding separately. All it does to use is the revenue is used to fund the capital before we borrow.
I understand. Thank you. Councillor Rennie.
Yeah, a couple of questions just based on Ellen, you're getting in too fast. You took my question there again, but basically, but to put a different spin on it, obviously there's some sort of borrowing side as well. Like, so there's not only the rent increases, there's also capital borrowing. Does the underspend affect the borrowing? We're going to go on to that treasury paper. Does it affect the borrowing profile because it takes it down, basically kicks the can down the road maybe for another year? And another question I have, just to cover them both, is we talk in this paper again about the void rent losses. This has been an ongoing issue that we've had in council. Obviously, it's reduced to what it was, but I'm just wondering, you know, what we can do to continue to improve that.
Thank you. So yes, in terms of the borrowing position, so we would always use our revenue first before we would go out to borrow, because borrowing comes with the cost, whereas we can use our revenue surplus for free in effect. So it would reduce our borrowing if we have a surplus, so we would use that surplus first. And again, depending on how we programme for future years, would determine our level of borrowing, but again, using our revenue surpluses first. In terms of your second question on void rent loss, I'm just wondering if there's a colleague on the, on. Right, Kim, also, sorry, I couldn't see you, Kev. Thank you.
Thank you, Chair. Thank you, Councillor Benny. In terms of the void rate, we are actively looking to take measures to reduce that. We have made it real progress in some of the work that we've done in bringing both the repair section of HRA and the HRA management together under the same management banner. Has actually helps the communication and some of the flow of information going back and forward between the team to reduce that void gap. And there's other aspects of work that we're looking at in terms of some of the systems that we're putting in place to even make some of the processes in that more streamlined. It was quite clunky, which added to the void gap period. So work is undertaking that, and it is something that is regularly reviewed as part of the Future Homes Board, which I chair. Alongside the capital programme in terms of monitoring how that's been progressed. What we have seen is that the properties that we are getting back, coming back to us in quite a bad state, so therefore requires longer term, and that seems to be a change in behaviour that we are experiencing at time. So we're trying to combat that at the same time as the improvement works that we're doing.
Okay, Councillor Rennie, is that fine for you? Any further questions? No? In that case, I'll formally close the paper. Seconder. Councillor Rennie, thank you very much. Does anyone wish to debate the paper? No. Quick show of hands to accept. There we go. Thanks. Thank you very much, Lindsay. Moving on. 25 paper 9, Treasury Management Quarterly Update yet again. A hat trick for you today, Lindsay. All right, 25. Fine. Off you go.
Thank you. So this report provides an overview of the Treasury management activities undertaken within the third quarter of the year ending the 30th of December 25 and confirms Council compliance with the Code of Practice on Treasury Management and the approved Treasury Strategy Statement during this period. The key highlights from the report: our cash balances were 12.3 million as at the 31st of December. A return of 4% was achieved on short-term investments, equating to 165,000, which was higher than budgeted due to active investment activity and prolonged higher interest rates above those budgeted. Interest rate forecasts at the time of writing the report have been provided by our Treasury advisors at Table 1, and this shows that rates are anticipated to remain fairly steady over the next 12 months. However, there is much uncertainty in the current climate, and we will keep looking at that and reviewing that on an ongoing basis. The borrowing requirement for the year is forecast less than budget due to the net effect of the general fund capital expenditure for both the previous year and the current year being less than anticipated. The repayments of existing borrowing amounted to 2.1 million in the third quarter, and additional borrowing of 20 million was undertaken from the PWB for the quarter to December, with a further 10 million expected to be borrowed by March, in line with our budgeted capital expenditure. No further debt rescheduling was undertaken in the third quarter, and overall the report presents a positive position on our Treasury activities. Again, any questions on it?
Lindsay, can you look at page 164, chart 2, the liability benchmark? I am struggling to understand what 400 million pounds is doing on that graph. But what do these lines indicate at 2045? What's at 400 million?
Unfortunately, my graph is not in colour.
So just for the three lines, the black at the top, then the dotted red one, and there's the yellow one above that. All soaring up into the stratosphere. And stuff on the ground, I can understand these are actual numbers of the outstanding debts, etc. But what do those lines represent?
So the lines are showing the level of loans that we've got. So that's broken down by the PWLB loans or global loans and our existing loan outstanding, and then our loan CFR. So we would always want to be below our CFR. So that should be our highest level. So CFR being capital financing requirement. So as long as our actual loans is less than that, then that is a positive position. But we're seeing increases because we're increasing borrowing per the capital programme. This benchmark, liability benchmark graph covers both the general fund and the HRA. So if you look back to the Treasury Management Strategy, they are split out. So you would see a difference in our general fund programme, we're expecting the profile to go up, then come down again as we reduce borrowing over the longer term. Whereas the housing revenue account, that is a constant increase in borrowing position as we go forward. So the two graphs together is actually looking at the position and increasing the borrowing for the council overall.
So as the next 20 odd years go along, the capital funding requirement, which is the top line, is going up and up and up. Okay, it's flatlining a little bit in 2044, 45, but does that represent the investment in capital expenditure we're expecting to make at that time, not necessarily the amount of debt that we have?
Yes, so both are related. So the amount of investment we make is traditionally funded by borrowing.
Yeah.
So that we have a small amount of funding that comes forward. So we do have to borrow. So in theory, yes, that's the level of borrowing going up.
Okay.
And the level of capital expenditure going up over when you take it cumulatively over those years.
Right, I'm not sure fully. I think I'll contact you separately on this one because I really don't understand this graph, what it's telling me.
Sure. Could I also offer there is a Treasury Management Strategy briefing for members being set up for I think it's the 2nd of June, where our Treasury advisors will be coming up and
Oh, good.
they may be better to explain it to you than myself, but obviously I can go through it with you beforehand as well.
Yeah, no, that's right. Good to know that. Okay, thanks. I have no questions. Anyone else? No more questions? Fine, I'll forward close the paper. Looking for second. Councillor Benny, thank you very much. And does anyone wish to debate the paper? Nope. Quick show of hands. Accept. Right, lovely. Thank you very much. Moving on, item 10. Which is the IJB budget. This will be given by Amy McDonald as the chief officer of law. Amy, are you there? Yes, you are.
Yes, I am.
Oh, dear.
Yes. Good afternoon, everybody. I'm just providing the budget paper that we tabled at the IJB meeting on the 25th of March. Our budget was approved subject to a recovery plan being brought back to the IJB at the end of June, just to provide the financial drift that we have this year. Currently, we have a forecast deficit of 19.673 million, of which we've identified savings of 10.815 million, with a further requirement to find savings of 8.858 million pounds. So still a significant amount of work to do that we're progressing, particularly through the first quarter of the year. So it's really to bring to those figures to members' attention, and I'm happy to take any questions on the paper that's put forward today. Thank you.
Yes, of course.
Yeah, I've got a couple of questions, Amy. I'm just wondering if you can give an update on where we are with the recovery plan to date. So what progress has been made on it? And I'm noticing the pressure on the prescribing budget there. I'm just wondering what work has been done to kind of like really drill down and to keep the prescribing budget down. You know, I know I get mixed reviews from people kind of in communities about descriptions, etc. So it'd be interesting to hear what's been done there.
Yeah, so we have a prescribing group set up, and we're actively managing, if you like, the drugs that we're dispensing within the prescribing budget. Certainly last year that work was strong, and we managed to mitigate significant amounts of inflationary pressure. The prescribing budget sits within, obviously, the NHS element of budget. So whilst we have significant pressure on the prescribing budget, we managed to identify underspends in other areas to balance off against that, which enable that area of budget pressure to be mitigated. We're looking at further work across prescribing next year. We've also got a number of pressures which we need to manage against, but the team are certainly well across that. We are relatively limited on what we can do in that space, but certainly as we go forward and we have better intelligence, we are able to look at polypharmacy reviews where people, for example, may receive more than 10 drugs. We're working with our GP practices as well to see what support and help they can provide as part of the prescribing work that they do. So it's not without its gains. There's definitely opportunities, but it's something that we need to keep working at. In terms of what we're doing in relation to the recovery plan just now, when we put forward the budget at the beginning of the year, we have identified a number of savings areas. We haven't got savings against all of those because I was concerned about, if you like, double counting some of the savings we have within the 10.8 million. As we drill down more into the development of the savings plans, that we will be able, we're looking to see what else we can draw forward. I've set up governance around that, the Budget Savings Oversight Group, where every item that we're looking to deliver a saving on has a clear plan behind that and is monitored at 2 weekly intervals. So we monitor it kind of mid-month and then at the end of the month when we have the financial performance results through as well. So that process should allow us to keep our savings plans on or as near to as we can to budget throughout the course of the year.
Thank you.
Councillor Rennie.
Thanks, Chair, and thanks, Amy. In terms of I've asked this at IGB before and it confuses me, so maybe I'm still not really understanding it. So we're obviously projecting a deficit budget for that year. Why are we not asking for greater upfront costs rather than continually going to a deficit budget? Because each year we know what our ongoing costs are going to be. So, and we know that our ongoing costs were a deficit the previous year, they're a deficit this year. And I know that we're looking to develop further savings, but from what I can recall, we've never really managed to do that. So that's my first question. Then on the further details of the 26-27 savings, we're looking at reviews of care provision of older people, learning disability. These are areas of significant vulnerability, and I just wondered have we considered the impact that these savings will have in terms of people in those sort of high vulnerability category groups? And, you know, also, and my third question really is the further 8 million still to be recovered is substantial and probably high risk. Have we considered what we're going to do? And are there any areas where there's we could particularly make change, like Ellen had talked about the prescribing budget? And I think, like in terms of mental health, for example, potentially that could cross with the commissioning plan, the mental health commissioning plan, because a lot of the prescribing will be for antidepressants. And I wondered if a lot of our preventative work would address that. Sorry, that's a lot of questions in one.
Yeah, thanks for those questions. I'll answer those as best I can. In terms of the funding and the process we're taking just now, the integration agreement that we work to sets out the process we need to follow. So before we would ask partners for a contribution, it's really important that we ourselves undertake a review to see how best we can balance our budget internally by way of a recovery plan before we would propose a requirement for risk share contribution from partner organisations. And that's the process that we are following this year. Certainly, there will be quite a lot of scrutiny and visibility provided to members, and certainly we would like to share that with partners as well. You mentioned the impact assessments that we will be we'll be carrying out across the areas of budget, and how do we know that we are, if you like, got valid and realisable savings. Well, in the 21-22 year, there were reductions made to care packages across the piece, particularly across care at home packages and also residential care. So we've got an evidence base there which helps support the delivery of our savings plans this year. And certainly I've been working on that this week, and just kind of having that more in-depth review as what was done previously and how we will structure and actually deliver those savings this year is something that is, if you like, part of my daily tasks just now. So I need to be able to really push into that to accurately forecast how we're actually going to deliver that and how the teams will be pushing those savings forward. But as for any savings that we would look to deliver, we will carry out the appropriate impact assessments, because we need to be aware of that. And particularly you mentioned mental health and how mental health is managed across the piece, and there are lots of interventions for mental health. We need to make sure that we're using all our assets to help people, not just the assets that we provide, and that goes across care at home as well, because there's lots of opportunities to help and support people within the community, and it's incumbent upon us to make sure that all those resources are brought into play. Thanks.
Amy, with regard to the 8.8 million, how confident are you that that actually can be worked out? Because by my calculations, if we had to pay that money on a vote share basis, that would be equivalent to about an 8% rise in council tax funding. So that's obviously some concern to us as a council that's sweated its assets as hard as it can to this point, cut what we can. And so I must confess, I'm slightly concerned when I see a figure like that because of the implication that might have for just one part of the council tax rise. So are you confident that you can work down that figure to something much more reasonable, like nothing?
Ideally, I would love to be able to give you that confidence. As we sit here today, delivering the £10.8 million worth of saving is going to be a lot of work. I think that we have to be sensible around what we're going to be achieving this year and next year. And I presented also to the IJB in the paper, apologies, this is not in your pack today, but looking at our medium-term financial forecast and actually the actions that we need to take to deliver financial balance in the longer term for the IJB. We're looking at, if you like, this year, £20 million worth of deficit, which is a significant sum of money on an approximately £300 million worth of turnover. So I'm sure you'll appreciate the size of that, and in relation to the savings that the partnership have delivered in previous years. And certainly we are time constrained in certain areas because we need to transform service delivery in order to make real savings and increase the level of output, and whilst maintaining, if you like, our frontline services, which is of paramount importance. So I think we're looking more at a journey over the next 2 to 3 years to get the Health and Social Care Partnership into a degree of financial sustainability. So I think that this year carries a high degree of risk. I'm not quite sure yet of that £8.8 million, what further money we can save within that, and I'm sorry I can't give you that detail today because I'm still working through that. So but I absolutely identify and understand that it represents a very high risk at this current time.
Okay, thanks for that. Any further questions? No. Councillor Bassett.
Just on prescribing, I'm not quite too sure how to couch this question, but I've read various reports recently that GPs, there's a sort of misprescribing at almost the 40% level. And then today in the news, there's talk about a real shortage of drugs as a result of the war in the Gulf. I was just wondering what contingencies the board are putting in at a financial level to address these sort of issues.
So certainly prescribing budget is, if you like, it's prescribing within the community, and we have prescribing from secondary care. So around 50% of the prescriptions that people have are from drugs that they're prescribed in the acute setting in a hospital setting, and 50% are prescribed by GP practices. I think that my main concern perhaps is not perhaps on the prescribing, but the amount of waste that we see. We have figures that are quite accurate that suggest that 10% of all prescribing is wasted. And I think those are the areas that we need to push into. That is, for me, an opportunity, as well as looking and keeping on top of where drugs come out of their license and we move to a non-branded product. These provide the greatest gain for us because we have a significant mix of conditions that we treat. Also prescribing, I think we need to look at it in kind of through a different lens as well. It's preventative in a lot of ways. It keeps people well, it keeps people healthy. And I think that's maybe a point that's lost sometimes, that whilst we have a high prescribing cost, it helps mitigate other expenditure as well. Inflation is an issue for us, and it will be an issue over the next 12 months. We've seen significant fuel inflation. We have care at home as a significant service that we offer, where our care providers drive to people's homes in the community. We anticipate that over the next 12 months that there will be pressure from our commissioned service providers for a greater than inflationary uplift. The inflationary uplift that we've provided through is on real living wage, and inflation, unfortunately, we will feel it through all our consumption, and it's something very much we need to be wise to, certainly since we have had perhaps less certainty in the world economy. The medications that we buy from America are going to change in price, and perhaps we're more vulnerable to that than in other areas. And certainly that's something that we need to keep on top of. So as well as managing the financial savings that we want to deliver, we have to be aware that we are going to be faced with inflationary pressures, as will every organisation over the coming year, and we will do our best to mitigate those.
That's great, thank you.
Okay, if there are no more questions, then we'll move to proposal. Again, I'll formally propose the paper. Not much to be said about it, but just being asked to note 4 particular bullet points. So, seconder for the paper. Councillor Berry, thank you. Right, again, show of hands to show that we have noted the 4 bullet points. These points are noted, thank you. Next paper, number 11. Internal Actions Progress Report, and this will be given by Chris.
Thank you, Chair, and good afternoon, committee. This report invites the committee to note, comment on, and provide appropriate challenge on the progress being made in implementing internal audit actions. Appendix 1 provides an extract from the Pentana system, offering a comprehensive overview of progress against recommendations arising from internal audit reports, while Appendix 2 summarises the current position and ongoing activity. As outlined in Appendix 2, a total of 318 actions are identified from various internal audit reports, of which 264 have been completed, representing an 83% completion rate. While a number of actions remain outstanding, the Pentana extract provides assurance that progress continues to be made towards their completion and closure. Ongoing efforts have been made to ensure that all agreed internal audit recommendations are implemented in a timely manner. However, as previously reported to committee, increasing service pressures and resource constraints do continue to affect officers' ability to meet the agreed timescales. To maintain momentum, there remains a strong focus across directorates on driving progress. The completion of audit actions continues to be a standing agenda item at the Strategic Leadership Group and Directorate Senior Management Team meetings, with reporting to this committee now taking place on a quarterly basis in line with the committee's request. Chair, officers from across our directorates and corporate services and I are happy to take any questions before the paper is formally read.
Councillor Rennie first. Councillor Rennie, you get to go first.
Thanks very much, Chair. Thank you. So I'm very encouraged to see so many areas that have been outstanding for a number of years potentially being tied up by June 2026. So that's excellent to see that progress, but obviously this committee has looked at a very sort of limited assurance level for a number of years, and we're looking to improve that. Will there be a further forward audit plan to look at further areas that we can look at to improve that further?
Thank you, Councillor. The internal audit manager is at this moment working on the 26-27 audit plan. which will come, I think there's meetings and diaries to meet with Isabel, with the committee, and then it'll come up for formal adoption at the committee in June prior to summer recess. As part of that, audit and scrutiny committee as well, Isabel and her colleagues will table a paper in relation to the level of assurance that they have for this for the financial year that's just closed. So that will come up as well. I've got no indication at this point whether it moved from limited to substantial. I equally have no concerns that we've gone down any at this point.
Good, thank you.
Councillor Forrest.
Thanks. Given that there's quite a lot of outstanding, I suppose, indicators there, can I get assurances that across the service that there's a view taken to the areas that present the biggest risk, that they prioritise above, kind of maybe the less risky areas?
Thank you for the question, Councillor Forrest. Absolutely. So over the last few years, our internal audit providers have now graded the recommendations, grades 1, 2, 3. So grade 1s are the most significant, highest areas that we do focus on. And internal audit do a regular review of follow-up of those, and those are the areas that our services should actually be tying down on and managing that level of risk at the lower levels. Whilst we should be action and closing of all actions, grade 1s and 2 particularly should be the ones that should be the focus.
Chris, can we look at this is adult social care purchase order arrangements. I mean that one's at 41%, so that's proceeding very slowly. What are the delays that are affecting this progress?
Now, maybe invite, if Amy is still on the call, know that Amy has taken not necessarily ownership but oversight of this. This was a follow-up audit review. You'll recall we had adult purchase orders arrangements review 18, maybe two years ago, and it was no assurance, and there was a further follow-up review on that, and again, there was no assurance. So committee, that was one of the reasons committee had asked that this report now comes back on a quarterly balance basis to show that improvements have been made. The completion dates in the report as is are the previous action completion dates, and they've been now moved on. Some are for March 2027, some are for April 2026. But maybe Amy will have a view in terms of the areas where there's been not so sufficient progress in the past, but there is progress now being made, and assurance that progress is now on track.
Yes, absolutely. I went through the audit myself and the audit recommendations and how we were going to meet with those. I've got the report's been updated, so you can see the actions that we're going to progress with staff, and there are named individuals that have responsibility for those actions. I've also spoken to our head of internal audit, who is Graham Templeton, who is helping support me in the delivery of the actions of the report as well. So we've kind of got that ongoing monitoring as we go through the audit action remediation work that we're doing just now.
Okay, thanks. Any further questions? No. Once again, I'll formally close the paper. For seconder. Councillor Forson, thank you. Right. Does anyone wish to debate the paper? No. Right. Well, we're asked to note, comment, and challenge the report. Show of hands to see if we accept the paper. Right. Thank you. Now we go on to 12. It's the annual fraud risk assessment and assurance report. This will be good. 5. B.
Thank you, Chair. Morning, councillors. Good afternoon. It is good afternoon. I obviously thought was keen. This report provides assurance on the council's current counter fraud arrangements and highlights the key actions underway to strengthen them. The core message is that fraud risk is recognised as a material risk to public funds, and we're moving from a historically reactive approach to a more proactive preventative model. A key step has been the recruitment of a corporate fraud investigator in post since February 2026 to build capacity and drive improvements. There are three main points to draw out. First, governance and policy. Up until now, progress has been limited on the earlier Audit Scotland recommendations to review and update anti-fraud arrangements. The priority now is to refresh the anti-fraud policy framework, strengthen governance and accessibility, and deliver targeted communications and training. Second, reporting and investigation rules. The whistleblowing policy was approved in October 2023. Is being comprehensively reviewed alongside the development of an anti-fraud and corruption policy. Third, prevention activity. Alongside the policy refresh and targeted, the Council is using practical prevention controls that help reduce opportunities for fraud and error. This includes our mandatory participation in the National Fraud Initiative with internal audit overseeing readiness and follow-up activity ahead of the next national exercise. In short, we're strengthening capacity, identified clear governance and training actions, and we're embedded a more preventative approach. The key assurance is that capacity has now been strengthened and we have a clear forward plan. The key gap is pace, specifically how quickly we can finalise, embed updated policies and how quickly training and awareness can be rolled out. Happy to take any questions, and I'm also joined by my colleague, Kaylee Robson-Jones, who is now our new fraud officer.
Hello, Kaylee. On board. What would you say would be? What would you say would be the next things we will see happen visibly?
I'll let Kaylee bring on that.
Yes, so thanks for the question. So I think visibly, the next steps are to first get the policies written and approved through governance. So we'll see those policies coming through to yourselves in the next few months. And then visibly after that, the training and awareness piece needs to be embedded across the council. So that can be produced by myself, so in conjunction with HR. We've already started those conversations in how that might look. And once the training and awareness pieces have been rolled out is when we'll start to see a more reactive approach of those investigations being able to come forward to us. So it's a long-term plan where obviously patience will be required, but they are the key steps of the journey for at least the next 6 to 12 months.
Okay, just wondering about the timeline, roughly when we might see something biting, something investigations coming up, roughly. Just to manage our expectations, that's all.
So I think we're seeing that. We're already seeing that through whistleblowing. We're seeing that through, inquiries with Kaylee already around that. I would say that Kaylee, has hit the ground running. We've got a strategy that she's been working on for the last kind of month and a half, which us just need to kind of fine tune. It's all going in the right way at very quick pace. But be assured that we are doing, everything we need to do as a council in terms of fraud. It's just, the fine tuning of that and getting that training. I think the training will definitely bring about. We have found that when you start to roll out training, with certain things that, it starts to bring about, particularly the whistleblowing, we could see that start to bring, more inquiries.
And have you a way of improving the uptake of training? Because other reports that we get here about people not taking up training opportunities. So this obviously is something we want to get a broad acceptance on.
Yeah, I mean, I would speak to my HR colleagues. I think fraud and fraud prevention is, in my view, mandatory. We should all be doing it. It should be something that we should be doing. You're right, it's very hard, but we do have the TLF and the SLF training programs that we run. And that normally does have a decent uptake. And so we probably look to run them through there in the first instance, with a view to getting sort of maybe more key targeted officers involved in that.
Thanks.
Now, maybe also come in on that to say, obviously, we do have our Class Academy, which is an online platform, rather than bringing lots of people into rooms, etc. But I think part of the awareness, part of the programme is the awareness really and the communications that we do around that. So whether that's posters or notifications that how to spot fraud, where you're aware of it, because people may not notice it. And we do see also from internal audit a number of things come up at a national level that then influence our internal audit plan. For example, we saw the council tax report at Aberdeen City Council in relation to a fraud issue. We then undertook an internal audit investigation here. We had some recommendations that there was no assurance given in terms of that. So yeah, it's awareness raising, it's a training, it's campaigning, it's communication, it's involvement of staff. So we understand that, as well as their external presence, I think, and the ability of our communities to report fraud to us as of this year, and how our presence in relation to the ability and ease of that can be done.
And do our troops know how to contact you?
Yes, they do, and we are looking at as well at a potential, updating obviously the fraud page on Connect to make sure that that there is those clear links. And but yeah, Kaylee has pretty much introduced herself to everyone. I mean, that's been one of the things that she has been really good at, and very good communicator within the council.
Councillor Rennie.
Thanks, Chair. In terms of, I know you're mentioning the training on the back of the whistleblowing policy. Often even training's not enough to make people stop being afraid of coming forward, particularly in whistleblowing policies. Often they'll say things like, if it's a spurious allegation, it could cause disciplinary action, and that puts people off right away, because often that burden of proof's quite difficult to achieve. So I'm just wondering, in terms of the training, will it be made really clear to people that they'll be safe within that situation and reporting? Because that can sound a bit frightening to people when they're coming forward. So I just wonder how you'll get that across to people, that it will be a safe environment to report.
Yeah, I think that's something that will come over time, if we are all on board in building the culture of it being a safe place to be able to bring your concerns, and that's not just relating to fraud, that's relating to whistleblowing as well. So I think in terms of the training and the awareness piece of the posters, etc., it's just going to have to be just a really clear message in that we are a safe place, but we want to hear your concerns, whatever they might be. And the only way that any disciplinaries or further action will be taken against somebody for raising a concern would be if it was a malicious accusation, for example. If it was just incorrect or there were no findings, there's never going to be action taken against anybody for bringing genuine concerns to us. So it's about building that culture from the ground up. And again, that might take some time, but if everybody's on board, then it'll be something that we can embed all together.
That's really good to hear. I had a bit of a follow-up question in terms of, obviously as councillors, we are not staff, but we do hear a lot in our communities about different things that arise, and we may have things that we could bring. Is there any way that councillors can support in this process?
Thanks for the question, Councillor Rennie. It's already happening. I've certainly had that experience myself already, and I would actively encourage any elected member to speak to either myself or to Kaylee in relation to anything that you do here. It's very tricky, obviously, when you're dealing with anonymous claims. That can be a trickier one. But we take these things very seriously. We do look at it. We do, we decide whether an investigation needs to be carried out, and then if there's one done, it's thoroughly done.
Okay, thanks. My final question is on the serious and organised crime side of things. So obviously, you're saying you work with partners, including Police Scotland. Would Police Scotland make intelligence reports to the council? Say, I'll just give an example. Say there was somebody that was one of our providers, who the police had knowledge of. Would they bring that to us to make us aware that there was a risk to the council?
At the moment, we're not aware of anything. However, I do have a meeting in place next week with Police Scotland, so that is something that I'll be able to bring to the front reports that we've done.
Answer as well.
So, yes, Councillor Rennie, we do have information sharing in place with Police Scotland. So predominantly that is through services like trading standards, but also procurement. So where there are particular concerns or risks relating to a supplier or a contractor, then information is shared between Police Scotland and Club Manager Council at the moment on where there are known organised criminals trying to conduct business with Club Manager Council.
That's good to know. Thank you.
Okay, any further questions? No further questions. In that case, I would again formally propose the paper. Looking for a second. Awesome, thank you very much. Okay, right, we have to note, comment, and challenge the report. It's heard, so quick show of hands, accept paper. Yep. That's it, that's our last item, apart from this report right here, which applies only to the Audit Scrutiny Committee themselves. That concludes the formal business of today's Audit and Scrutiny Committee meeting. And I'd like to thank members and officers for their contributions and engagement throughout the session. The committee will recall that as part of our 24-25 annual report, that in order to support reflection, review and self-development, members would, on a voluntary basis,